I'm not sure who they have them. I've been invited, I'm not sure who. Not Andy, but
I wanted to make your kind of. So I think one of you guys can talk, and then when we're done, I can have permission here, and we'll just flip. Jerry Rice is a public citizen. Oh, okay. Oh, great. Okay. So, we're not really recording. Are you done? 11. Yeah, very good. Very good.
Is there anything? What's your position?
That's on the
I got yours. That's why I gave you a card.
I'm the chief operating officer of Mission Health and the president.
Yeah.
I'll make sure we have some. We are happy to talk about
Oh, you don't know. People only send when they're angry, so.
No, I get that.
exactly what we're going to do.
And there may be some questions. So we want to get,
Nice to meet you. Thank you for having us. I appreciate it. Nice to meet you.
It was great. We had a whole house.
I'm already fed up. That's why you got
this afternoon now, and appreciate Mandy and her staff for putting together the agenda for the day. And so the first thing that we wanted to get some information about is the issues with Blue Cross and Mission and the contract that's being renegotiated there. So we're fortunate to have some representatives from Blue Cross, Blue Shield, as well as Mission who are here with us today. So to get the meeting started, I think we just wanted to give each of them a chance to share their perspective on where things are at between the two organizations, and renegotiating this important contract between these two important health service providers in our community. So from Blue Cross, we have Patrick Brady and Chris Evans. So thank you both for being here. They're from Charlotte and from Durham, so they traveled to be with us today. So thanks for being with us, and we'll hear from them first, and then after that, Jill Hoggard-Green and Katie Garner are with us from Mission, and we'll let you guys have a chance to share have a few minutes to share your perspective as well. And if any commissioners have any questions for either, we'll just, we'll have time for that. After that, then we're going to hear from Kurt Euler and Jim Holland to kind of update us about what some of this means for us as an employer in the community. And obviously, this is a work session, so we're not voting on anything today. This is really just so we can get a little bit better educated about these issues. So that's the first thing up. Following that, we're going to talk a little bit today about our economic development policy and where we're at with some of the existing economic development agreements. We're going to talk about small minority business, supplier delivery network. Lisa's going to lead that. And then following that, we're going to have some more discussions about our budget process. And, so those are the main topics on the agenda today. Do any commissioners have any questions about the agenda? All right, well, great. Well, let's just go ahead and get started then. And so Chris and Patrick, thank you again for being here. We're just going to give you guys a few minutes to just share some information. And again, if commissioners have any questions, write them down, and then we'll give you a chance to ask any of those once they're finished.
Hi, good afternoon, everybody. I'm Patrick Brady, and I am Director of Major and National Accounts at Blue Cross, North Carolina. And I'm here on behalf of Buncombe County and our other clients here in the western part of the state. I've put a document in front of you. Hopefully everybody has one of these, front and back. What I want to do is highlight 3 key areas in that document. And as part of that document, I also want to clarify some inaccuracies that we've seen up to this point. So Blue Cross Blue Shield, many know us. However, I think it's important as context and background just to say we have served our state for nearly 85 years. And that's a commitment that we take very seriously. We are the only ACA plan that is in all 100 counties of our state. We are a fully taxed not-for-profit, and last year we paid $478 million in federal, state, and local taxes. Now, our legislative requirements dictate 3 to 6 months in reserves, and we fall squarely within that parameter at about 3.7 months. And if I may clear up a couple of things, you'll see on the bottom right of the front part of that sheet, our profit margin the last 5 years has averaged 1%. That is largely driven by the fact that we are the only insurer in this state in the ACA market, and it is no surprise that we have experienced significant losses during that time frame in the hundreds of millions of dollars. We insure 3.7 million, just round numbers here, 3.7 million of 10 million North Carolinians, and we're very proud of that. On to the topic that we were asked to speak to today. I will say that Blue Cross North Carolina was as surprised and as disappointed as anyone that Mission chose to terminate its contract and walk away from negotiations. We have had a long-standing policy that once that happens, the negotiations stop. So if you were to say, well, what would it take to get the 2 sides in discussions again? It's very simple. Rescinding the termination will put us back at the table together, negotiating on your behalf. We were also surprised that a contract that wasn't even up for negotiation, the Medicare contract, was also part of the termination. And that affects thousands of seniors here in the western part of the state. Overall, if you said, well, how many people are we talking about? How many Blue Cross members we have in this part of the state? We are talking about impacting 260,000 North Carolina members in 16 counties. Roughly half of these members work for employers that are self-insured. So the impact that we're talking about here affects the local economy and these employers' bottom line. And in addition, as I mentioned, there are more than 2,000 Buncombe County seniors and 6,000 in the 16 counties that are affected by the Medicare termination. Why are we here? How did we get to this point? The reason I'm here is to represent customers. And the issue that we have at hand is our customers cannot continue to bear unreasonable medical cost increases year after year. On behalf of our customers, we have a strong obligation in the market to make sure that we can provide affordable products and services to them. So that brings us to what this dispute with Mission is all about. Mission has historically, as you see on the background here, enjoyed guaranteed increases from Blue Cross. What we are simply asking for at this point is that those increases are tied to quality and outcomes, and that any increase is based on the benefit to the member in terms of high quality care. Let me put some numbers into perspective for you. So the increases that we're talking about would affect Buncombe County, because you are a client of Blue Cross's. It would affect Buncombe County to the tune of roughly $550,000 next year. That would be the amount of increase just for Buncombe County. All right, let me give you a hypothetical. So if we're talking about a service that costs $100 today, next year that service at a 6% increase would be $106. The year after it'd be roughly $112, and the year after that it'd be roughly $119. Our customers are saying loud and clear to us, they can't continue that. It is not sustainable. So what we are asking is that the entire market take a pause from what is expected increases in medical expense. So let me be clear, we're not saying that there is no increase in the future of our relationship with Mission. We're saying that increase should be based on outcomes and quality. What we are saying is we are asking the market to pause for a year so that we can help our clients rein in these increases. Over 40 hospitals in our state have agreed to work with us on that. It is no different than what we have asked of Mission. So what happens next? Mission will, on October 5th, be the only hospital in our state that is out of the Blue Cross network. Again, let me repeat what I said earlier. It is our hope that Mission will rescind the termination, because at that point, negotiations can begin again. I cannot stress that enough. Let's talk about our members, our customers, you. So between now and October 5th, nothing changes. Care can be received the same way it is today at in-network providers. But starting October 5th, all Mission hospitals, outpatient facilities, and most professional providers will be out of network. And you're probably thinking, okay, where does that leave us, right? What do we do then? So there's three things that I want to stress. And know that we are hard at work to make sure the member does not get caught in the middle of this. First thing we call continuity of care. What that means is if you're going through a pregnancy or ongoing treatment for a chronic condition, you qualify for continuity of care, which means that you can receive in-network benefits for some period of time. Point number two, if you are not able to access a provider within 60 miles for high volume services, such as cardiology, then you can apply to Blue Cross to have that paid as in-network. If it's a high impact procedure, let's say oncology, cancer treatment, for example, and there's not a provider within 90 miles, the same thing applies. You can request of Blue Cross that be paid in network. Now, I've been really encouraged with how other providers, hospital systems in the area have stepped up to say to us, we are going to support your members so that there is no disruption in their care. So on the back of the sheet, and we couldn't put them all because there's a lot of specialties, but on the back of the sheet we have listed several maps that show, it's kind of a heat map of where access to certain specialties lies, including hospitals. Now you might ask, well, how does somebody that doesn't have this know what's going on? On our website, in the upper right corner, you go to our landing page, you will see a splash that talks about mission. You can click on it, there's a whole landing there that will take you to alternatives, what's going on, and we think that's important. We think that's important to keep our members educated on what's going on. So those are the options that we have for our members. And I would offer this as well. After October 5th, one of the things that we've seen when negotiations are difficult in other parts of the state, what if Mission offered the members of the 16-county area not to increase their out-of-pocket costs? What if they offered to waive that difference so that they're only collecting what the in-network rate is? Because after all, it is the member that is affected here. It is the member who will be getting that check for that out-of-network service. So we have to think about the member in that context. What is the impact to them? Let me repeat what I said earlier. It is our hope that the termination be rescinded and that Blue Cross North Carolina and Mission be back at the table negotiating a deal on behalf of you, our customers. So the bottom line is we've been here in this state and in this community for nearly 85 years. It's important to us. We're not going anywhere. We came today to make sure you know where things stand and that you know that we're committed to moving forward and working through this. And with that, if there are any questions, I'd be happy to answer those.
Thank you for the presentation. My name is Jasmine Beachfar. I represent District 1. Could you review the plan for post-October 5th regarding emergency situations and people needing access to emergency room? Would they be expected to travel out of county to meet their
Thank you.
emergency room?
I was remiss in not saying, at any point, if somebody needs emergency services, go to the nearest emergency room. Those are always paid in network, so thank you for that catch.
Thank you.
All right, are there any other questions for the Blue Cross? No, okay. All right, thank you very much, Mr. Brady. And let's ask the Mission folks to come up and let's give them a chance to share their perspective on this. And I'm sure you guys will stick around so there might be some follow-up questions with for Mission as well.
Good afternoon. I'm Jill Hoggard-Green, and I have the privilege of serving as the Chief Operating Officer for Mission Health System and as the President here at Mission Hospital. You know, at Mission, we know it's a privilege to serve you and your families and all the residents of Western North Carolina. Our over 12,000 outstanding caregivers every day are working together to provide nationally recognized, high-quality care that's safe, compassionate, and it's actually provided in a very sustainable way. as your only regional network that's a safety net for the whole region. You know us. We've been working collaboratively together, and I'm looking over here at Mandy, to tackle incredibly critical issues that are important to the people that we serve. If you think about last year, we created a family justice center, a child advocacy center, and created what I believe is an innovative national model of how we are providing access for behavioral health patients. I can tell you without a doubt, I would much rather be up here today talking about how are we going to take on the next critical issue for the people we serve, and how can we create an innovative solution to do that. Unfortunately, I'm up here talking about an issue that, despite Mission being at the table for over a half of a year, in good faith negotiating at all times in the same kind of collaborative methods that we do with you, has not resolved. And if it doesn't resolve, it has, and I'm not overstating this, it has devastating impacts to the care that you have come to know and love. Blue Cross Blue Shield actually forced this issue. They have a very intimidating three-pronged strategy that keeps health systems from actually having the right dialogues that we're having today, and I appreciate that. And that strategy is, first, our contracts are on an automatic renewal, which means unless we come to an agreement and they can just say, we're not agreeing, it's zero forever. Second, with that automatic renewal, they have the ability to say, we are going to pick up a deadline. We're not going to listen to you about a deadline. We've been actively negotiating. We've been collaborating. We're asking for a deadline. We got to bring this to a close so that we can move forward. They've said to us the only way to have a deadline is to actually give the notice of termination, which we've done. We share the same outcomes and the same beliefs that our Blue Cross Blue Shield colleagues said. We want to negotiate. It's time to get back at the table. But it's pretty nonsensical that they aren't. So know that that's really one of the issues we're trying to work through is, I think both parties actually want to mutually agree to get back to the table to get this done. But we need to get that done. Last is they also, and they kind of joke about this, which actually makes me concerned. In this state, and actually most states, half of the states, it's over half the states around the country don't allow this, but in this state, if you do go out of network, they pay the beneficiary directly. And they joke that the provider will never ever see those resources. I think that's inflammatory because I believe we have people with great integrity. But we also know at Mission that about 15% of the bills, as they pay them, are paid inaccurately. That puts a consumer in the middle of a very difficult conversation. So we'd prefer to actually negotiate, we'd prefer to bring this to resolution. But please know, here are the things that are very, very critical to us. And Mission is different when you look at us compared to other health systems across the country, and it's the reason that I'm about to share with you. We have what's called the Mission math problem. Every year, the input costs that we can't control, those wonderful medications, those chemotherapy agents, those technologies, and those supplies have at least a 5% increase. For quaternary hospitals like ours, it's over 11. So it's a very high increase. Second, and this is what's different, we have the privilege of serving Western North Carolina. 70% or more of our patients that we serve have their care reimbursed by Medicare, Medicaid, or on charity care. That's very different than in most communities around the country and particularly around the state. What's important is those Medicare and Medicaid beneficiaries are having basically we're getting very little reimbursement, and it's negative reimbursement. It's usually below zero when you look year after year over the last 5 years. What's also really startling, and the reason we actually need to be talking about how can we tackle another critical issue, this year alone, the amount of charity care, the dollars that are provided for charity care at Mission Hospital specifically, for Buncombe County residents, have increased over 40% than last year. There is something going on. The patients that we're seeing from Buncombe County are coming in with traumas. They're coming in for surgery. There's increased emergency room use. That's over a 12-month time period. Now, we usually provide $120 million of charity every year, and we're proud of that. We had 4 women who started Mission Hospital over 130 years ago, and they did that because they wanted to make sure there was access for everyone. So providing charity care and making sure we provide access is near and dear to the values that we have. That said, that number is escalating because of the trend rate that's happening right now in terms of charity. What that means is 70 to 75% of the people we serve, we have negative reimbursement in terms of the care that they need year after year. That means the 25% of us that are privileged to have insurance, and I see that as a privilege, the privilege to have insurance, have to be able to cover for their beneficiaries the modest inflationary costs that we can't control. Now, you could probably say to us, so why aren't you, this is a normal business problem, why are you cutting costs? You should be able to do that just like all the rest of us, we all have to balance our checkbooks. What I can say to you with great certainty is our teams are exceptional and have been actively reducing costs. 3 different studies will help you see that. Last year, the New York Times actually highlighted Asheville as a very unusual community because they were looking across the country saying, lots of places, lots of health systems say they can control costs for Medicare beneficiaries, but they push it over to commercial. What they showed is they called Asheville out and said, Asheville's really odd. They're the 32nd lowest for the total cost to Medicare beneficiaries and 32nd lowest for cost to commercial. The only way that happens, and Mission Hospital is your hospital in Asheville, is we're reducing costs every day. We have an independent study that looks at our charges across the state when we compare ourselves to our peers, and again, we're a trauma center. When we compare ourselves to our peers, we're lower than 20% of their cost and charges. If we look at our local peers, we're less than 7% of our local peers. Now, here's the thing that's very important. Those 12,000 teammates and caregivers that are working every day, they have been reducing costs dramatically over the last 5 years. Over the last 5 years, they have reduced over $240 million of costs. That's $250 million. But as they do that, they know they're taking care of you and your family. So it's not like a store where we just say we're going to slash prices. They've got to think about how are they reducing. They're using the best methodologies from lean manufacturing. They're utilizing evidence-based protocols from around the country. The teams are constantly taking out costs. This year alone, they're taking out $70 million. Next year, they're planning to take out $50 million. These are our frontline caregiving teams working together. Now, we'll continue to do that. But the speed at which we take those costs out have to be made very measured so that we do it effectively to ensure you get that high quality care. Now, while our teams have been reducing costs, I can't tell you the number of employers that have come up to me personally and handed me their premiums over the last 5 years. We're seeing consistently double-digit increases that Blue Cross Blue Shield has been providing to employers in this community. We also know, we do know that they struggled in 2015 and 2016. And like any nonprofit, you have struggles at any given time. But during that time, they had struggles because of the healthcare exchanges and their IT systems, which are now corrected. If you look at their net incomes today, they're doing quite well. So, for us, what's really important? We are here to serve you. I know you asked us to come here to actually talk about how you could help us. And how you can help us is continue to encourage the insurer that insures your beneficiaries, the people that are really important to you. Encourage them to be back at the table. Know that we'll use the same creativity that we've used with you to solve and tackle problems. We welcome pay for performance. Our outcomes are some of the best in the country. We're under all other systems are under pay for performance. But we must have an inflationary increase, a small inflationary increase, so that we can continue to have the services through all of the people that we serve in Western North Carolina. It's a privilege to be here. It's a privilege to work with you. I see a resolution to this but it does mean that both parties have to be at the table, and we have to know that we will have the resources to be able to provide the care. I don't overstate it. For us, our teams are doing everything they can, and they are providing care and quality that's some of the best in the country. For the 5th time in 6 years, we're a top 15 health outcome, a top 15 health center, and that's not because we apply for that. It's the outcomes we're achieving on quality, safety, patient experience, and being low cost. So I'd love to answer your questions and would love to see how we can move this forward.
Thank you very much. Yeah. Go ahead. Commissioner.
I got a problem with the mission.
Yeah.
We're gonna spend $430 million on another building. Making money somewhere. You have bought about every doctor in this town out. You have taken all their properties off our tax rolls, so we're having to go up on taxes to cover the people's things. Okay, let's back up for a minute. I have cancer. I've had it for 4 years. I'm not defending Blue Cross Blue Shield. I was in business for myself, and I paid my insurance for my people for 34 years. Okay? I didn't use that. But now, thankful to Buncombe County, I can. But the fact is you're going to, because when my wife had a procedure to blow up the kidney stone 3 years ago at St. Joseph, the bill was $10,000 or $15,000. That was just to go in for the surgery, not count the doctor. She went back for a second one, and it was $25,000. So how is Blue Cross Blue Shield supposed to, you say you're going down, but everything's going up? You bought Care Partners. You bought everything in this town. We have no doctors. Because you took them all out, you know, if I go to my oncologist now, it's in the network, which I do go the 2nd and 3rd, and I have a birthday on the 4th. If I make it for then, I'll be 70 years old. But you people need to get back to the table. I'm not saying that they're the best people, but this is, you're talking about a big policy in this town. And if you treat us this way, as this county, and me being a commissioner, I submit that I'll go somewhere else that they'll pay in county network. And I guess I'll have to get a new oncologist, a new lung doctor, and the whole package. But anybody telling me you're building a $430 million building, it's going to benefit me, and you're going to tear something down. And not only did my wife go in there and have surgery, she got an infection during the process. That y'all brought out the whole package. So, yeah, chemo was really good for me, 25 rounds of it. But, you know, don't blow smoke. You need to get back to the table. And you need to figure out all these buildings, these doctors that you're buying out, that pay the bills you have. You know, I have no doctor because you bought them out. You have run doctors off. We had a whole group here that were putting people to sleep. We're not here putting people to sleep anymore. So, you know, I guess, but I am not going to defend Blue Cross Blue Shield. That probably pay a little bit more. But the fact is it's not all. And I'm, you know, maybe I'm a little hard, but just how about letting us have the property tax back on the buildings that you bought from the doctors? And I think that'll help the county and stuff too.
So Commissioner, I hear several things. And first, and I'd like to address a few of those, but recognize
We are here talking about the Blue Cross Blue
Right,
Shield
right,
mission issue.
right.
There's a whole bunch of different issues there, but if you'd like to, you know, to respond to any of that.
Yes, let me just respond on 2 accounts. The first is, I would love to have a further discussion about your own personal care, your family's care, and any ways we can improve. Because every day our teams work on improvement.
I'm not worried about my personal career. I'm worried about the employees in this county and the county.
And
That's only my is the employees in this county, not me.
I appreciate that, and so am I. I am very concerned about making sure they have access to very high-quality care. 2 things. You raised the issue of the building. The issue of the building is critical for Western North Carolina, the Hospital for Advanced Medicine. And that's because we studied the St. Joe's campus. We studied extensively in 2011, can it continue to support for the next 30 years or even the next 10 years the kind of care that needs to be provided? The cost to remodel it and make it at the codes that we need it to be at were actually more expensive than building the building. So it is a large investment, and our board has taken great courage in saying, we've been here 130 years, we're going to be here for 50 to 100 more. And we have to put the right investments to make the technology available and to make us more efficient. We are mutually focused on the people that you serve. I am very concerned about them having access. I'm very concerned that every Medicare, every Medicaid, and every person that doesn't have resources can have access to care. We'll continue to work on our quality, and we're going to continue to work on reducing our costs. And we'd be happy to be at the table.
Well, when you go up $10,000 in 1 year on the same surgery, that's not reducing cost. I mean, I know math.
Understand your concerns. Thank you.
I have a question for Mission and Blue Cross that's
Yes.
addressed simultaneously. Are you all, I feel like this is a kind of classic dynamic of brinksmanship. It's playing out pretty publicly. And against the backdrop of a national crisis around healthcare, that my primary concern is the level of anxiety people feel about being able to access quality care. Have you all considered, would you be ready to commit to working with an outside mediator to get both parties back to the table to reach a negotiation?
At this point, we're really very willing to be back at the table. There's lots of ways to do that. We're very willing to be back at the table. What we have to know, what everyone has to know, Mission cannot be at a forever zero. That is not sustainable with the services that we have, given the issues that we
So
want.
I've got a question to her.
Let's let her question be answered first.
Come on, space generator.
Yeah.
So I would add a couple things. And I want to say that having a viable mission here is important. Blue Cross is not saying that is not important. It very much is. Two clarifications. One is, you just hit on exactly why we have the policy we do, which is when something goes to termination, it plays out in the media. And when it plays out in the media, it is not a good outcome and there is not open communication. It is for that reason that we have the policy of do not term. At the point you term, we stop negotiations. Negotiations don't happen publicly. This isn't going to forward our ability to bridge our gap in this meeting today. This meeting today is to help you understand where we are. But getting back to the table requires one simple thing, and that is rescinding the termination. The second thing I'll clarify, the forever zero comment is very catchy, but it's not true. The forever zero comment, if you heard my comments earlier, we have asked for a pause of 1 year on medical cost increases. We have given Mission guaranteed cost increases for the whole life of our past contract. It is accurate to say that if a new contract isn't reached, that there is a clause in there that will continue at the current rate. What we are advocating for is a new contract based on quality and outcomes. It is not forever zero.
I'd like to make a recommendation that you all work with a mediator to reach resolution on this. And we'll let it stand there.
So I want to piggyback on your comment because it's one of my, in my past life, I worked with mediators quite often. The first thing that I thought when I heard both of your presentations, the fact that, pretty much, we are very cordial to each other, but if there's a refrigerator door, it's pretty chilly. So, this is a very difficult thing, and it's emotional because what I've heard is your positions, and I've not heard the effect on the public. And I know both of you because you've been in this for a long time, you're very caring individuals, I'm sure. But this has become this corporations trying to figure out a contract. And you're going to have somebody's going to have to step in to be able to do it. And so one of my questions was, are you using or planning on using a mediator to fix this problem? And the other thing is, how long has the contract, the zero effect, how long has that been in place? And why is it all of a sudden now a problem?
That policy has been in place for a long time. It's an auto-renew, and I'm not sure, I've only been with the organization less than a decade. But an auto-renew, that when I said it's an intimidating practice, it sets you up for never having a deadline. And recognize we've tried, and recognize we've had deadlines, and recognize that we would love to be at the table figuring out the right solution. You asked the question of, we're not thinking about the people we serve.
Actually, that
Actually,
is.
yeah, well,
Actually, that's not what I said.
Appreciate that. We are both thinking about the people we
I
serve.
actually said that both of you, I'm sure, are thinking about it, because y'all have been in, I mean, you've been with Mission, I'm sure, for a long time, you've been doing what you do, you do it because you deeply care. This is about, nobody cares about all the contracts, nobody cares about all this, okay? Nobody cares about all this. The timing of this is horrible at best. If I was CEO, CFO, whatever title I had, somebody within both organizations must recognize the timing of this is terrible, given the situation in Buncombe County and the amount of people that rely on Blue Cross and rely on insurance. So, as people at the high level that you are, somebody's got to step up, take that kind of recommendation, fix this, because this is not about a mission commercial, about how much you're saving or not saving or whatever, you know, and I'm not beating up on mission or you at all. I'm just stating facts. When you enter into a tremendous aggressive growth that has occurred within the corporation, then certainly there's going to be some cost issues that you're going to have to deal with, and contracts that you guys are going to have to deal with. But this care has got to be provided, and somebody within the corporations has got to recognize that it is unacceptable for you to be in a termination status. It's unacceptable. Somebody's got to recognize it and fix that, and y'all got to negotiate that. We understand Mission's care. I appreciate Mission's care and providing care to my family, everybody, but that's your job. That's what you do. That's what you do. And so we don't want that to, we want you to stop what you do. This contract's got to be fixed because it's hurts Buncombe County employees. Now, I have tried, like some others, I went to other hospitals. I don't need to name them. But I had what I thought I had before I went to the hospital. Pay for it out of pocket instead of paying through the insurance. Actually, I had two different numbers. Right. That's the payment, so that's the other number. But for me, this is about corporations, and about you guys get together and figure this out. This is not, it's not acceptable for this not to be fixed and for some mediation to occur. I think that can be done. I think within your organization, if somebody, if you're moving chess moves and let's get out of the chess match, let's go ahead and realize that, you know, this is unacceptable, and just have a mediation or do whatever you need to do to enter back into negotiations. Because if you really want to enter into negotiations, you can do that. You can do that. You just got to get somebody above you or laterally you to do that.
So we really appreciate your counsel. You know that at Mission we want to be back in the negotiations. One point of clarification that's really important.
And you need to show us that you need to be back.
One point of clarification that's really important, and this is the truth. Mission, given that increasing amount of charity care and our 70% of Medicare, Medicaid beneficiaries, if you want to continue to see the same level of care throughout the western part of North Carolina, we are not in a position to say we can cut more costs to ensure that we have a zero going into the next years or two. Those are the issues. So I think that we are caring people. I look at Blue Cross Blue Shield, they are a nonprofit. Mission is only here to serve you and to make sure that everyone gets access. And we will continue to provide access. The resource conversations are important, and we would have loved to not be in here as we were negotiating in good faith and potentially can going forward. So we appreciate your counsel. I'm hoping my colleague across the aisle hears that as well. And we would love to see a mutual agreement that gets to assuring that sustainable services continue.
I would agree. I think that's important, and your point is well taken. To answer your question, 2013. That's how long this contract's been in place. So it isn't new.
Yeah, it didn't just start.
As far as the mediation, to me, there's an even better step. It is that we sit face to face with each other and try and work through this. And we have said in the 8 months, we will do that until a termination is submitted. That's unfortunately where we are. But we will come back to the table when that is rescinded.
Commissioner Whiteside.
Jill, good to
Yes.
see you here.
Good to see
And I'm going to say this is a long-time supporter of Mission Health. I was on the boards for some time, as well as a long-time representative, a long-time resident of Buncombe County. And that's why I'm on the commission, to represent the people of Buncombe County and the people of the first district I represent. But you know, when I listen to both of you, I'm sorry that I didn't wear my short pants here today. And the reason I say that is, we're sick and tired of being sick and tired of hearing complaints, how much you care for us, what you do for us. We know that. I'm a cancer survivor. I've been through Mission. But now it's time to sit down and show us that you really practice what you preach. And if you care so much about the employees of Buncombe County and the people of Buncombe County, let's sit down and do something. I hear both of you saying you want to sit down. You don't need a mediator for that. Just get rid of both legal departments and sit down and work it out.
We'll buy the beer.
I mean, you know, we people are getting, this is the problem I have with healthcare from Washington right on down. We keep hearing back and forth, we love you, we care about you and all. And I hear 2 nonprofit organizations talking about profits, you know, that's another issue. I mean, we won't go there. But all I'm saying is, I'm in representing the people of Buncombe County. We want to see something done. And it's time to sit down and talk to each other and save money from these full-page ads in Asheville Citizen Times or whatever you're doing. But show us that you really care about us. Do something. That's all I ask.
I agree with everything that's been said till my daughter was out for 10 years, and that was very good for her. Having said that, brings back to, I have every faith in all can be worked out. But in the event it doesn't, tell me about, like, I know an employee now who works in a different department who was recommended to have surgery in, I think, November. And now she's in a panic because she's learning that she has to do that earlier. And so it's fine, like Al said, the newspaper has all this stuff. And to recapitulate what everybody said at a national level, people hear all this stuff. On a local level, they hear all this stuff. I think we're the only people that get along, Republicans and Democrats, but all this fighting is one thing, but that employee that's petrified over that surgery, tell me about her today, what she should do in the event that this doesn't.
2 things. First off, we have a number where we're personally, all she needs to do is call and she'll get a personal conversation on how we can support her in her care. So I don't know the specifics with her care, but we do have a concierge approach to making sure that each person is getting what they need. We're going to be here. We're going to be providing that surgery if she so chooses to have it with us, and we would be honored to do that. But we do have a number to be able to help her walk through her conversations with Blue Cross Blue Shield, because she will need to walk through some conversations there. But we will continue to provide care.
How, and this is very general, but what about cost? How will her,
At this point, each plan is different. That's why we have an individual person understand their unique plan and then how to have the conversations with Blue Cross Blue Shield. So I don't want to say incorrect information, but know that we will hand walk people through that process because we are going to continue to serve. And we anticipate that people will continue to need the care that's happening at Mission. Now again, I think you've all said it. Your council is figure out a way to be at the table. We've been very clear with Blue Cross Blue Shield, we're ready to be at the table. They need to be ready as well. And you all need to understand the real headwinds. Because if our team was not reducing costs every day, that would be something that we would be very accountable for. They are.
Actually, we don't have numbers. Actually, we don't. I've got to figure out how somebody, how are you going to explain to somebody that they're out of network? When they go in and they see that bill, how are you going to come into Mission Hospital, they're going to walk in there, and somebody's going to tell them they're out of network? Now, if it's a local doctor or somebody that's or a dentist, you know, we chose this dentist when we go there and we find out they're out there. Oh man, you know, you're talking about Mission Hospital. Somebody's going to come in and you're going to tell them they're out network. They're going to go, what?
First off, they come through Mission Hospital's doors, we're taking care of them.
Well, you don't know that, but then the bills are.
And that's why we want to avoid. We would like to get this resolved, no question. We're just clear on what we need. And to your point, we'll then walk through, because it does look different for individuals based on their circumstances. You said earlier, if the person came through the emergency room and it was emergent, it's covered in a different way. If the person comes in. So we'd like to get out of that rhetoric and get it into the, let's get this resolved, so that there's more security for everyone.
Let's back up one second, please. In my situation, my doctor works for me. So he's going to be out of network. Both my doctors work. So they're both going to be out of network. So he's going to double down on me. So, you know, out of network costs more money. And so I'm going to physically lose my doctors. Let's just put it this way. What about before? I'm talking about the free deal. Okay, say, you're I'm 70 years old, and I couldn't afford to have a network policy as it is. These people are not making any sense whatsoever, because you have took all the doctors, you had a monopoly, and that's the worst thing that ever happened in this country. That's the way I look at it. I'm not changing from that, because you called everybody out. So it's you, the monopolies. And that's, you know, even telling people that did not want a flu shot, shall take over the place. Either they took the flu shot or they didn't have their job. Yes. So that's monopoly. That's dictation. Dictation is all about.
Is there for the coming fiscal year, is there a dollar amount on the differential? So the increase that Mission is saying, we need to hit this dollar amount.
We need a modest inflationary increase that covers our input costs.
Is there a dollar amount on that?
There's a percentage, and Blue Cross Blue Shield is very aware of what that is.
Is there a
Or
dollar?
is it a percentage? What is it?
It's a percentage increase from what they presently pay.
what percentage is that?
I don't believe that we're allowed to talk about that, not Mission, but from the contract negotiations, they don't allow us to have those conversations. So I apologize, I wish I could.
Yeah, I think what both saying here is, this is a small group here. 248,000 people ain't getting to hear what's going on here. And what I've heard, I really don't understand. So somehow, if you can get the media involved and tell some answers instead of what Commissioner Whiteside said about putting a short zone and walking through it. We need facts. Facts.
Happy to provide that. I think both of us provided facts today, but you asked additional questions, and we're happy to answer those questions.
You've hit on what I think is the most important thing, and that is the impact to the residents of the county. They're the ones that are going to have to soon start, not on October 5th, they need to start thinking about those hard questions now when it comes to continuity of care. We are preparing to do that, and the mission is as well. So if somebody were to call us, we would give them information on what their other options are. We would talk to them about continuity of care. So the example of somebody's already scheduled for a treatment, that continuity of care could happen at Mission if it is approved, but what you don't want is the surprise that somebody walks in the door and goes, "You're out of network." And I've got to say this before you break. I do a lot of these meetings with clients. I have never seen the passion that I see on your faces today. Never. That is one thing I will take back. I hope our two organizations can hear you, and if the determination is rescinded, we will be back at the table. But I appreciate all of your input today.
I have a. Go ahead. Okay, what is the odds of getting back together today and we'll get your plan?
The odds are we want it to happen. So the odds should be good if Blue Cross Blue Shield has the same perceptions that we have. They know our issues, we know theirs. I said from the very beginning, we're happy to sit down at the table and continue this conversation. What we can't do is continue it forever. We've got to have a deadline. And for all of you, both of us, we're here mutually serving the same people.
Thank you for being here. I just, and we didn't want to create a debate. I mean, we were trying to learn more about it, but I appreciate all the questions, and obviously you're hearing the concerns that commissioners have, based on the concerns for our constituents as well as our employees. So thanks for being here. Obviously, we're hopeful that that there's a meeting of the minds around this and a resolution. We have, and I think as an organization and elected officials, I think we have the arguments that you both made. There's parts of each of your perspectives that I think align with ours. I mean, we want to help control costs too. Because we're an employer, we represent a lot of businesses and families, so that, people probably want to nod their head when they hear Blue Cross talking about that. But we've got to have a successful, viable, hospital, and we want this to be worked out. So thank you for being here. If there's no other pressing questions now, I think we also do want to hear from Kurt and Jim about this, just kind of from an employer standpoint. So thank you again for being here, and best wishes.
Thank you.
Thank you.
Thank you.
Thank
Love
you.
it.
Thank you.
Thank you, members of the commission. Kurt Euler, HR Director. I'm here to talk about how this mission dispute is actually going to affect our employees directly and how this will affect our health plan. So I think the first thing you need to know is that there are 4,176 lives on our health plan. About 1,840 are actual retirees and employees who we call the subscribers, and then another 2,334 are spouses and other dependents. So that gives us a total of about 4,000 lives on our plan that we are responsible for. So we are self-insured. So what that means is that we actually pay every claim out of our pocket. We don't have an insurance policy where the insurance company is basically gauging the risk. We pay every claim. We contract with Blue Cross and Blue Shield to administer our claims. We also use Blue Cross and Blue Shield's network to determine how much we pay each provider. So Blue Cross and Blue Shield goes out and negotiates a rate, and based on that rate, that's what we end up paying to the thing. So they negotiate a rate with every service provider. Now, you need to know that there are different rates for different providers that provide the same service. So there are different rates. Nobody knows what those rates are. We just know that it costs different amounts depending on where you're going. Some providers charge less than others for the same service. So each month, Buncombe County essentially gets a list of claims, and we pay them based on what Blue Cross and Blue Shield has negotiated with the provider, and then we pay Blue Cross and Blue Shield an administrative fee per subscriber. All right, so in a nutshell, if any provider increases their rates, the county's going to bear that cost. So what do we do when the costs go up? Well, basically we have three options. Number one, the county pays for it. When I say the county, I would mean the general fund, or that's coming straight out of the fund. The other way that we can pay for that is the employee ends up paying for that. And that means that we can do a combination of increasing the premium, their co-payments when they go get a service, their deductibles, co-insurance, or raise their out-of-pocket maximum. Or the third option is a combination of all the above. So obviously, currently right now, what the big issue is that Mission and Blue Cross and Blue Shield are negotiating about how much each service at Mission's going to cost. And I think both sides agree that they're going to raise, there's going to be an increase, but the question is what percentage? So just to let you know how Mission affects our health plan, these are for the last 3 years, and one's a partial year, the total amount of our claims dollars are going to Mission. So about 48% of all of our healthcare dollars are ending up going to Mission. In 2016, it was 45.8%, and partially through this year, it's 50%. So a lot of what we spend is going to Mission, and when I say Mission, that's not just the hospital, that's the doctor practices, other facilities that are associated with Mission. So it's a very broad spectrum, inpatient, outpatient, and professional services. So really the county is going to end up, the county and its employees are going to end up having to somehow figure out how to pay for any increase in the rates. So that's pretty much a given. So on the flip side though, just so that it's not all, also Blue Cross and Blue Shield also can charge us more in administrative fees. So for this, we have this great network, obviously it's going to cost you. So we're constantly battling administrative costs and what we're going to be paying out of pocket for the claims, and that's kind of a constant battle that we're going with. So what I want to do is kind of give you an example of how this is going to directly affect the employee. All right, so I'm going to give you how an in-network transaction works. So right now, Blue Cross and Blue Shield pays the provider directly for in-network. They have an agreement as to how much whatever service you get, it's going to cost. So the employee goes to whatever the provider is, and they're responsible for either paying a co-payment or a deductible, but that's basically their out-of-pocket expense. So they pay that up front, or they can be billed. The county then so what we end up paying is the allowed amount minus whatever the employee pays. So if the employee pays $30 on a doctor visit, and the doctor visit's cost of the allowable amount's $200, the county ends up paying $170 on that. But the thing about the in-network that's important to the employees is once you pay your deductible or you meet your out-of-pocket maximum, you don't have any more liability on that service. So you're basically taken care of. And basically, with our health plan, you have a maximum liability per year depending on your plan. So you really know how much out-of-pocket you're going to end up spending if you go in-network. So I'm going to give you an example of a hypothetical. So the negotiated rate for the service is $500. Or $5,000, sorry. The out-of-pocket maximum, or let's say the total liability for the employee based on the plan, is $750. Now this amount may differ depending on what plan you have, and we have 3 plans. So Blue Cross is going to pay the provider $4,250. The employee is not going to owe any money, and Buncombe County will be billed that $4,250. That's a simple example of in-network. So let's now contrast that to what's going to happen for an out-of-network transaction. Number one, the employee is responsible for 100% of that provider bill. So right up front, the employee is going to be billed whatever that amount is. The employee will also be responsible for paying an additional out-of-pocket, out-of-network deductible, so they'll have additional liability from the amounts that they're paying, and it's a lot higher, so it's almost double what they would be paying for the in-network. The employee and or the provider would file the claim with Blue Cross. Blue Cross and Blue Shield will reimburse the provider directly, or no, they will reimburse the employee directly. And Blue Cross and Blue Shield will only reimburse the allowable amount for that service, less whatever the employee's paid out of pocket. So then it would be up to the employee to pay the provider. That's how when you're in a Blue Cross and Blue Shield policy, or at least our policy, that's how out-of-network works. Now let's take a look at an example. So providers charge different amounts. So the allowed amount that they may negotiate with the insurance company may be different than what their actual street price, or I guess I'd say retail, for a better less. So in this case, the retail amount of this service is going to cost $10,000. Well, there's a bill amount I could use on, but just think about that it's a non-negotiated rate, so it's essentially whatever the provider wants to charge. So the maximum out-of-pocket liability for the employee would be $1,500 in this case, and this is based on the standard plan. This amount will be higher for employees who are on the buy-up and the core plans. So the maximum allowed amount for Blue Cross's maximum allowed amount for this service would be $5,000. So the employee would end up, they file their claim, they would end up getting a reimbursement check for $3,500. But the employee is still somebody's going to owe the remaining $5,000 that's left on that bill. So theoretically, the total amount owed by the employee will be $6,500 for the service, and the amount charged to our health plan will only be $3,500. So really, in this case, the employee is good. The out-of-network is really bad for the employee, and so I just want that to be up front. Now, I don't know what the providers are going to charge. I don't know whether they're going to charge them a different amount, but it's really between the employee and the provider, and that's what's a little scary. Next slide. So once again, if Mission becomes out-of-network, the employee is going to become responsible for the bill. Blue Cross will only reimburse the allowed amount, and the employee is basically going to be responsible for the remainder of any difference in that bill. So once again, they'll also be it's the remainder of the bill that we're really concerned about. And in some cases, and I just want to say that what the retail amount and what the Blue Cross negotiated amount, that's usually a very different, very significant difference. So that's what's really scary for the employee. So I want you to know what HR and what the county, what we're doing for our employees. I think the most important thing is we're communicating with them. We sent out a notice to let them know what's going on. We're going to keep updates. We're going to put up a web page and try to get as much information as possible to the employee because we want them to know. We're also meeting with our Blue Cross representatives, and we hope to meet with Mission so that we'll have a plan in place if this comes to pass, shall we say, for October 5th, and try to help our employees because our goal is to put them in the best position. We're also looking at other third-party administrators that may have Mission as an in-network provider for our plan year starting January 2018. We're in kind of a unique position right now because our plan year ends December 31st. So we can basically leave Blue Cross. We have a lot of options where a lot of the other entities in this area are running a July to June contract. So they're kind of stuck in their contract. So we have the ability to get out. We're also working with our Blue Cross and Blue Shield representatives to have a plan in place for January 2018. So that's what we're doing as the HR department with our employees. And we've been getting a lot of calls, and I know that this is really important to every employee, and I take it very seriously. So what I kind of want to do is give you a timeline, at least from the county standpoint. So at the end of August, we kind of are facing sort of our own negotiation issue here where we have a contract with Blue Cross and Blue Shield, and we are required to give a certain amount days notice that we are terminating our contract, and we need to make that decision by the end of August. So in September of this month, we're going to have to decide, are we going to stay with Blue Cross and Blue Shield, or are we going to go with somebody else? That's a decision that we're going to have to make as an organization, because come October, we need to start holding open enrollment for people to sign up. So whether it's with Blue Cross or whether it's with another provider. And then January of 2018, our new plan year is going to start, and whatever we enter into, that will be in effect from January through December 31st of 2018. So that's really kind of how this affects us. Happy to answer any questions that you may have.
Robert and I both serve on MSD board, and I don't think this is a very good solution, because I think it's against the county's altogether best interest, but MSD is advocating for people to go to Park Ridge, and I didn't know how much that was a common.
We have been working with Park Ridge. We've been working with Park Ridge for almost over a year. They have a lot of similar services, and I'll be really honest, at a lower price for the county's health plan. We met with Park Ridge actually last Friday, and in the letter that I sent out to the employees, I gave them, Park Ridge also has a concierge service where I sent out that information for them to call and to make contact with Park Ridge and see what it takes to access their network. A lot of the things that I found is that's been making that difficult is the doctor, like if you're seeing a doctor like an OB-GYN, and I hope did I say that one? Okay. I sometimes get that word mixed up a little bit. I just wanted to be sure, but thank you. But like if you're going to be having a baby, your doctor's admitted to certain hospitals. So if they're only admitted at Mission, it's going to be hard for to have your doctor do it at Park Ridge. So yes, employees are going to have to, if they want to make a switch, they're going to have to take the time. But we definitely do have that open for our employees, and we are working with Park Ridge.
What makes it hard again is just like Mission, when you buy the doctor, that takes it away from Park Ridge. They cannot go to Park Ridge to do any work.
Well, they would have to have a doctor that basically, I mean, it's kind of like Google and Apple, you know, there are networks, and usually Park Ridge has a network and they have doctors, whereas Mission has a network and they're a Mission doctor.
Well, it's just like, everybody was talking about, you know, the doctor, my cancer doctor, he works in Marion, so, but I come to find out Mission owns his hospital in Marion, so that don't help.
Well, I guess my point is that I look at Mission as our community partner. I think in many regards I think it's great living wages, we don't have to do that. So I hope we can work this out. They can all work it out so we stay correct. Because we do have a lot of, we're a community and we do share a lot of things.
But I just want to say from an employer standpoint, or at least for somebody running the health plan, we have to be very cognizant of every time that there's an increase. Because right now, drug costs, and you know, we may be facing just out of the blue a 5 to 10% increase. And then when you start adding additional costs onto that, that adds up. And you know, if you're having a 10% increase every year, your plan's going to double. You know, and
I hear you.
so.
I'm hopeful.
But yes, no, I definitely.
Can you fill us in a little on what you're seeing in terms of other TPAs and how viable an option is?
Well, we are planning on actually meeting with Mission. Mission has their own service that we're planning on meeting with them. And we're also going to be meeting with United Healthcare, who is another provider like Mission, or like Blue Cross and Blue Shield. They don't, and they're in the area, and we're going to meet with their representatives too. Sure.
Other questions?
I guess my only question about follow-up on what you said, isn't it going to happen with all of them under Blue Cross and Shield, United Healthcare? I mean, I think they're all, I mean,
Well, for us being self-insured, you know, what I'm most interested is how much are you going to charge for the service? So yes, we could switch to somebody else, but if they have, you know, if their rate with Mission is a lot higher, that's going to end up costing us the same amount. So yeah. Okay. And their contract can come up for renewal in the next year or the year after.
So I think you're looking at all those options as we have to, with ours. And the reality on if I have to have $10,000 procedure, we go to Mission and get it done, and all this changes, now more money. I'm either gonna pay it or I'm not gonna pay it. Some of these folks are going to decide not to pay. A lot of it, there's no pay to do, judgments and all that. Because that happens all the time with medical expenses.
Right, that's why it's like, if the number of house of bankruptcy in this country is getting sick, they're not being able to pay the bill, and they ruin their life.
I mean, that's the major issue as a country, is when we get sick, it's expensive to get sick, and those costs are there.
Right.
I just want to make the point too that for counties in North Carolina, all 100 of them basically provide the same services, most of which are mandated by law. So we compete for a workforce that has very specialized credentials and training requirements. I use environmental health inspectors. We hire somebody out of school, fully qualified in terms of education. It takes them 2 years to have the code requirements to actually inspect restaurants or help people with their on-site waste systems. We made a choice as a county many years ago to make our benefits our premium way to recruit and retain staff. When those benefits erode, you have to think through the impact to this community. It's your social workers, it's law enforcement, it's environmental health, it's permits and inspections, it's erosion control, it's landfills. It's things that will stop this community from functioning as a healthy, stable community. And I think that also weighs heavy on us as a staff and realize that.
Because it definitely, whenever something like that happens, employees do notice that out of pocket, and that is a significant change in their income.
I just have one process question, Kurt. So, if I understand the information you presented correctly, so if we are going to continue our current contract with Blue Cross, we have to make that decision by the end of August?
Well, based on my reading of the contract is that we need to submit our notice of termination by the end of August. That does not mean that prohibits us from still talking to Blue Cross and Blue Shield, and our reps have said that they want to keep working with us. So I have nothing to indicate otherwise, but I think we do need to give notice, yes.
Just to be clear though, I mean, does the same thing happen to us in terms of not being able to negotiate after August if we file a notice to terminate?
I don't know.
Well, we just, I'm asking.
No, they say no.
So you would keep talking to us? Okay.
But I just wanted you to know that I'm still reading the contract literally, so.
All right. My question's a little bit different, but I just want to get it in before we close out the topic. So I'm very cognizant that we're lucky that we have a county that provides great health insurance. And there's a lot of people in the county who are paying out of pocket through the ACA, and their only option to get coverage is Blue Cross Blue Shield. There haven't been many public forums for a robust discussion of this. So before we close this out, I'd like to just take a second. We have a pretty significant responsibility to the people we represent. We don't have the luxury of having an employer who can negotiate this.
Yeah, I think that is a great segue. Great segue. So Jim Holland's going to talk to you about how this would affect the community.
Okay, thanks.
I do just want to take just a couple minutes to tell you what the impact could be to the community safety net. Right now, there are 21,500 recipients of the CARE Act. And as you said, that's through Blue Cross Blue Shield, and they are currently the only provider in Western North Carolina that's enrolled in the Affordable Care Act. Almost 20,000 of those receive a substantial subsidy of about $560 a month towards the premium for that. That's been a very successful program, in Buncombe County. It's dropped the uninsured rate from 19% to 11%. Still a significant number, but that's a significant decrease since the Affordable Care Act has come into play. The one area that does not impact, which are the poorest of the poor, are about 8,500 that are uninsured that do not fit in, that are not eligible for any subsidy, because those would have been the ones that, had Medicaid been expanded in North Carolina, would have been covered under Medicaid. So 8,500 of those folks, they remain the same. They still remain uninsured. So when we look at what the impact could be, Blue Cross has tentatively said to CMS that they are committed to it for another year to the ACA. Our understanding is that they have to notify Blue Cross, they have to notify CMS, Centers for Medicare and Medicaid Services, at the federal level by August 6th of their intention to remain. If they decide not to remain, there is no other provider in Western North Carolina by which those folks would be insured. There are providers, other providers in the rest of the state, mainly United Healthcare and Blue Cross, but no other provider in the western part of North Carolina. So those folks, if Blue Cross pulls out, would be essentially uninsured. Medicaid recipients, of which there are over 43,000 in Buncombe County, they are not impacted. They're under the Division of Medical Assistance, and that's a separate agreement. Health Choice recipients, which had been originally insured through Blue Cross, are not impacted. That's also through the Division of Medical Assistance, and that's another 2,700, and those are children.
Oh, okay.
Yes. So, how does this impact federally qualified health centers? We have 3 federally qualified health centers in Buncombe County. We have the Minnie Jones Health Clinic on Biltmore Avenue. We have Appalachian Health Center on McDowell. And then we have Blue Ridge Community Health, and their primary location in Buncombe County is in Arden, South Asheville. They see about 19,000 patients a year. Over half of those are uninsured. So let's say the ACA has had a very positive impact on the financial health of an FQHC in Buncombe County, because now they are able to have a payment source for a lot of those uninsured. The reality will be, if there is no Affordable Care Act coverage, then most of those patients, if they are receiving a private provider, will either be uninsured and get their acute care in the emergency department, which is not the best thing to do, or they will try to link to an FQHC. And so that means the FQHCs will see a fairly dramatic increase in their uninsured rate. And they are incentivized through the federal government for cost settlements for their Medicaid and Medicare patients to help cover the true cost of that care. And the reality is that helps cover the uninsured. And so that margin becomes ever more tight. That's a very broad view of what the impact would be to citizens in Buncombe County that are considered in that safety net.
Thank you. Questions? All right, thank you to the staff for the updates as well on this meeting. And that's obviously really complicated stuff, a lot of moving parts. So thanks for getting us a little bit further of a learning curve today. I think we're good on this. It's a little bit longer than we planned for, but it is complicated. I think we needed to have it. So thank you. All right. Short break. Let's take a short break. Let's get started.